I'm Dr. Pierre Rigaux. I'm a physician now for 32 years. I'm Belgian. I have worked with the industry, in the industry of medical device for more than 15 years now. And I have been medical director in a complex company in Switzerland and the vice president for medical affairs in Minneapolis for a rehabilitation company. I'm the medical director of the Cefaly project team, which is as a project to apply neurostimulation on the head by a non-invasive means, mainly external neurostimulation. Cefaly is a medical device you place on the head and which is intended to treat and prevent migraines and headaches. It works with microelectronic impulses to be active on a nerve, which is the main nerve of the head, responsible of feeling the migraine, feeling the headache, and the Cefaly is the medical device who acts on this nerve to treat the migraine. Nobody was able so far to use neurostimulation on the head externally. So we decided to launch the Cefaly project with the purpose to be able to develop a simple medical device, easy to use, comfortable but able to excite the cranial nerve, able to apply external neurostimulation. Cefaly has three main programs. The first program is for the acute pain during the migraine attack or during the headache to reduce the pain. The second program is a program you use when you do not get the headache or the migraine attack. So that's a program to prevent the migraine attack, to reduce the frequency of the headache and the migraine. And the third program is a program more to struggle against the stress, to reduce the tension and reduce the stress. The device is like a pair of glasses that you put on the head. There's the electrodes. There are two conductive areas which enter in connection with the contact blades. And the plastic pin here is just to guide the electrode with the device. So you clean up the skin of the forehead, you degrease the skin, then you place the electrodes on the forehead, and then you put the device on the electrode. Afterwards, you have just to push on the switch and the treatment starts automatically. The intensity increases progressively, and when the patient feels it's a little bit strong, he presses again on the switch and the intensity stabilizes to the end of the session. A basic session is 20 minutes. So in prevention, that's a daily session of 20 minutes. During the migraine or during the headache, to reduce the pain, 20 minutes is a little bit short. So usually the patient has to repeat a few sessions of 20 minutes, and in order to have something like 40 to 60 minutes of treatment to reduce the pain. Cefaly is very safe and it can be used safely by a pregnant woman, by breastfeeding women, by young people, children, and in all the situations where the consumption of drugs is contraindicated. Cefaly does reduce the medication consumption. In the clinical trials, the patients who are improved by the Cefaly reduce the drug consumption by 75%. We recommend a daily session of 20 minutes for 3 months, and once the result is very good, afterwards the patient can reduce the frequency of the use, reduce the frequency of the session. Instead of a daily session, a session every 2 days. So I'm very excited to launch the Cefaly in Australia because all the conditions are filled to get a huge success.
A product by Oz Health Pharma.